Living with diabetes presents unique challenges, and dealing with erectile dysfunction, or ED, can be particularly frustrating. You're not alone. Many diabetic men experience this, and effective solutions and support are available. This guide will equip you with the knowledge and tools to understand the connection between diabetes and ED. Open communication with your doctor is key. Don't hesitate to discuss any concerns or questions you may have about ED or managing your diabetes. We'll delve into the medical aspects of how diabetes and ED are interconnected and the impact of blood sugar levels on sexual function. Understanding the underlying causes of ED is crucial in determining the most effective treatment approach for you. Beyond medical interventions, lifestyle modifications play a pivotal role in managing both diabetes and ED. We'll explore practical tips on diet, exercise, and stress management techniques. Living with diabetes and ED can be emotionally challenging, so we'll provide resources for professional counseling and support groups. By addressing both the physical and emotional aspects of your health, you can pave the way for a more fulfilling and satisfying life. Let's delve into the science behind why diabetes and erectile dysfunction often go hand in hand. Sustained high blood sugar can damage blood vessels and nerves throughout the body, particularly in the penis. This damage can reduce blood flow to the penis, making it difficult to achieve or maintain an erection. Diabetes can also affect hormone levels, particularly testosterone, which plays a vital role in sexual desire and function. Some medications used to manage diabetes symptoms might have side effects that contribute to ED. By managing your blood sugar levels effectively, you can significantly reduce the risk of developing these complications. Understanding the intricate link between diabetes and ED is the first step towards effectively managing your condition. Stay tuned as we delve deeper into the impact of blood sugar on sexual performance in the next section. High blood sugar can hinder the smooth flow of blood to the penis, making it difficult to achieve the firmness needed for sexual activity. Managing your blood sugar effectively is like giving your body the green light to perform at its best. When your blood sugar is within a healthy range, your blood vessels can relax and dilate properly, allowing for optimal blood flow to the penis. By making healthy lifestyle choices and working closely with your healthcare provider, you're setting the stage for a more fulfilling and enjoyable sex life. High blood sugar can injure the delicate lining of your blood vessels, making them less efficient at transporting blood. Damaged blood vessels restrict blood flow to the penis, leading to weaker erections or difficulty maintaining them. Diabetes can also damage the nerves that send signals from your brain to the penis, disrupting the critical communication needed to initiate and sustain an erection. This nerve damage, known as neuropathy, is another common complication of diabetes that can contribute to ED. Understanding these underlying mechanisms is crucial in developing effective treatment strategies. In the next section, we'll explore various treatment options available to help you manage ED and regain control of your sexual health. Even though diabetes can cause damage, there are ways to manage and mitigate these effects. Keep reading to learn more about the treatments and lifestyle changes that can help you on your journey to better health. Addressing ED in men with diabetes often involves a multi-pronged approach, targeting both the underlying medical condition and the specific symptoms of ED. The first step is working closely with your healthcare provider to manage your blood sugar levels effectively. Once your blood sugar is under control, your doctor may recommend various treatment options for ED, tailored to your individual needs and medical history. These options range from oral medications to lifestyle modifications and even psychological counseling. With the right approach, you can overcome these challenges and enjoy a fulfilling sex life. One of the most common and convenient treatment options for ED, particularly in men with diabetes, is oral medication. These medications, often referred to as PDE5 inhibitors, work by increasing blood flow to the penis, helping you achieve and maintain an erection. Some well-known PDE5 inhibitors include sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra. It's crucial to consult your doctor before taking any new medication. as they can interact with other drugs you might be taking for diabetes or other health conditions. While these medications can be highly effective, they work best when combined with other lifestyle changes, such as diet and exercise. PDE5 inhibitors may not work for everyone and can have potential side effects such as headaches, flushing, or indigestion. Open communication is key to ensuring your safety and finding the most effective treatment plan for you. While oral medications are often the first line of treatment for ED, several other options are available if they prove ineffective or unsuitable for you. One such option is alprostadil, a medication that can be injected directly into the penis or inserted as a small pellet into the urethra. Another alternative is vacuum constriction devices, which work by drawing blood into the penis using a vacuum pump. In some cases, your doctor might recommend penile implants, which involve surgically placing devices into the penis to help achieve an erection. The best treatment approach varies from person to person and depends on various factors, including the severity of your ED, your overall health, and your personal preferences. It's essential to have an open and honest conversation with your doctor about all available options so you can make an informed decision about the best course of action for you. Choosing the right treatment for ED can feel overwhelming, but remember, you're not alone in this journey. Your doctor is your trusted partner in navigating these options and finding the best solution for you. Start by being open and honest with your doctor about your symptoms, concerns, and any medications you're currently taking. Together, you can weigh the benefits and risks of each treatment option and develop a personalized plan that aligns with your individual needs and goals. While treatment can significantly improve ED, it's essential to understand that it might not be an overnight fix. Be patient with the process and continue to communicate openly with your doctor about your progress and any challenges you might face along the way. Diet plays a crucial role in managing both diabetes and erectile dysfunction. A balanced diet that controls blood sugar levels can also help improve blood flow, reducing the risk of ED. Focus on whole, nutrient-dense foods that are low in processed sugars and high in fiber. Foods rich in antioxidants, such as berries, nuts, and leafy greens, can help protect the blood vessels from the damage caused by high blood sugar. Incorporating sources of healthy fats like avocados and olive oil can improve vascular health, crucial for maintaining good penile function. Consulting with a nutritionist can provide personalized dietary advice that considers both your diabetic status and your sexual health needs. By making informed choices about the foods you eat, you can take a significant step towards improving both your diabetes management and your sexual health. Exercise is a powerful tool for managing diabetes and improving erectile dysfunction. Regular physical activity helps regulate blood sugar levels, improve circulation, reduce stress, and increase overall energy levels. Cardiovascular exercises like walking, swimming, or cycling can enhance blood flow, which is crucial for achieving and maintaining an erection. Strength training helps build muscle mass, which can enhance insulin sensitivity, making it easier for your body to manage blood sugar levels. A combination of aerobic and resistance training can be particularly effective. Exercise also has profound effects on mental health, reducing symptoms of depression and anxiety that can contribute to ED. Always check with your healthcare provider before starting a new exercise regimen, especially if you have complications related to diabetes. With regular, enjoyable physical activity, you can improve not only your metabolic health, but also your sexual function and overall quality of life. Section 3. Stress management and mental well-being. Chronic stress can lead to poor blood sugar control and may also cause or exacerbate ED. Mindfulness practices like meditation or yoga can be highly beneficial. Cognitive behavioral therapy, CBT, is another effective tool for addressing psychological aspects of ED. Maintaining a healthy social life and getting support from friends and family is valuable. Ensuring adequate sleep is crucial for stress management and overall health. Section 4. Combining lifestyle factors for optimal health. Managing diabetes and erectile dysfunction requires a holistic approach, combining diet, exercise, and stress management. Integrating these modifications can enhance quality of life and health outcomes. It's about making consistent, manageable changes for overall well-being. Regular checkups with healthcare providers are crucial. Remember, the journey to better health is a marathon, not a sprint. Celebrate small victories along the way. While we've delved into the physical aspects of erectile dysfunction, it's equally important to address the profound psychological and emotional impact it can have, especially for men living with diabetes. Erectile dysfunction can significantly affect self-esteem, body image, and overall confidence. It's common to experience feelings of frustration, anxiety, embarrassment, or even shame, which can put a strain on relationships and intimacy. The experience of ED can trigger a vicious cycle. The initial physical challenges can lead to performance anxiety, where the fear of not being able to achieve or maintain an erection becomes a self-fulfilling prophecy. This anxiety can further exacerbate ED, making it even more challenging to address. It's crucial to remember that you're not alone in these feelings. ED is a common condition, and many men, especially those with diabetes, experience its psychological impact. Acknowledging these feelings and understanding that they're a normal part of the experience is the first step towards addressing them effectively. Remember, seeking help for the emotional and psychological aspects of ED is a sign of strength, not weakness. In the following sections, we'll explore strategies for breaking the silence surrounding ED and accessing the support you need to navigate these challenges. Section 2. Breaking the silence, communication, and support. One of the most powerful ways to cope with the emotional impact of erectile dysfunction is to break the silence and talk about it. Opening up to your partner, a trusted friend, or a family member can provide invaluable emotional support and understanding. Sharing your experiences and feelings can help alleviate the sense of isolation and shame that often accompanies ED. Remember, communication is a two-way street. Encourage your partner to share their feelings and concerns as well. Open and honest communication can strengthen your relationship and help you navigate this challenge together. If you're struggling to have these conversations on your own, consider seeking professional help. Support groups, both online and in person, can also provide a safe and non-judgmental space to connect with others who understand what you're going through. Sharing experiences, coping mechanisms, and advice with others facing similar challenges can be incredibly empowering. Remember, you're not alone in this journey, and seeking support is a sign of strength and self-care. In the next section, we'll explore the benefits of professional guidance in addressing the psychological aspects of ED. Professional guidance, therapy, and counseling. While open communication and support from loved ones are essential, seeking professional guidance can be incredibly beneficial. Therapists provide a safe space to explore feelings and behaviors related to ED and diabetes. Therapy equips you with coping mechanisms to manage anxiety and stress. Cognitive behavioral therapy helps challenge negative thought patterns. Therapy helps couples communicate openly about their concerns and desires. It strengthens their bond and intimacy. Seeking professional help is a sign of strength and commitment to well-being. Section 1. Reclaiming your sexual health. Managing ED and diabetes is a multifaceted journey requiring a personalized approach. Work closely with your healthcare provider to develop a tailored plan. You are not alone. Effective solutions are available. Embrace lifestyle changes to improve your sexual health and well-being. Approach this journey with a positive mindset. Reach out for support from your partner, friends, family, or a therapist. Every step towards managing diabetes and ED brings you closer to a healthier, happier you. Section 2. Join the conversation. Your journey continues. We hope this guide has provided you with valuable insights and practical strategies for managing erectile dysfunction in the context of diabetes. Remember, knowledge is power, and staying informed about your health is crucial for making empowered decisions. We encourage you to continue exploring the resources available to you. Consult with your doctor, reach out to support groups, and engage in open conversations with your loved ones. We'd love to hear from you. Share your thoughts, questions, and experiences in the comments section below. Let's create a supportive community where we can learn from each other and navigate this journey together. Don't forget to like this video and subscribe to our channel for more informative content on men's health. Your journey to better health continues, and we're here to support you every step of the way.